a lot of patients that grind or clench, they're not even aware that they do it. They're just aware of the fact that they sometimes have a headache, they break teeth. And so a lot of times being able to educate a patient what is tooth grinding or how are they grinding their teeth, and actually showing them by sliding their jaw with the mirror how those teeth are fitting perfectly together in a position that they would never think that they would go to, because they're doing it at night usually for the most part. So a lot of times the grinding, if you catch it early enough, you can treat it very conservatively by having them wear either something as simple as a retainer, just thin enough so where they just can't come into contact with their upper and lower teeth, to something like I'm wearing more of a night guard, which is a thicker appliance, which is made custom for the individual. You take the impressions and you actually spend that second appointment when they come in, you spend a fair amount of time balancing it out. And what you're doing is eliminating interferences. So when they slide, because they're going to slide side to side, they're not banging or bouncing over something, they're just sliding very smoothly. And in doing that, you're not only protecting the teeth, but you're also allowing the muscle that operates our jaw to relax. So, and by slightly opening them with a mouth guard, you're essentially putting it in traction. I mean, years ago, and they don't usually do that as much. I have like TENS unit and other things, but years ago they used to put weights on on their leg to kind of relieve pressure on the back, because by just applying a slow, constant weight forces the muscle to relax because it can't tense up anymore. It's kind of what you're doing with the mouth guard. By slightly keeping them open and preventing them from clenching, that muscle has no option other than to relax. With the night guards, I mean, you can not only protect the patient's tooth, you can get them to a point to where they don't have any more pain. I think the most extreme case that I remember is that I had a patient of mine, I've been a patient for a while, and he came in and he was telling me about he's being worked up for a brain tumor. I go, wow. I go, he hadn't gone in for a scan, but he had this chronic headache and da-da-da. And so I said, well, can I just check a few things? And there's certain areas that you can check in a patient's mouth to kind of find out what's going on. So I kind of went in, and sure enough, I went and checked a couple spots, and he immediately jumped. And so I said, you know what? I said, you need to proceed with that, getting checked out for brain tumor, but could we make you a mouth guard? He said, absolutely. So I put a rush in with my lab, and usually it takes about a week to get it made. We got it back to him in 2 days. Within about a week, he was asymptomatic. And to this day, he tells everybody that story. He still had a scan. Luckily, he didn't have a brain tumor, but it was strictly just a really acute pain being caused by the TMJ. And the TMJ is your temporal mandibular joint. So when someone says, I have TMJ, it's like, yes, you have two of them, one on each side of your face. Now, if you have TMJ pain or disorder, that's describing that there's something wrong with your TMJ. So, but in extreme cases also, you kind of go through, you treat somebody conservatively, whether it be retainer, whether it be some type of guard, and a lot of times that works. And then we have some patients that we're able to benefit them by using Botox. Botox, as you know, is most widely known for eliminating wrinkles. But the way it eliminates wrinkles is it paralyzes the muscles that are pulling the skin in a certain direction, which causes those wrinkles. Well, how it works when you're treating migraines is that it turns out that 80% of migraines are muscle related, 10% are vascular, and 10% are hormonal. So those 80% of migraines that are muscular can be treated a lot of times in conjunction with a mouth guard and Botox. And so what you're doing is in muscles like on the side of the face and other muscles along the side of the head or even up in here, by relaxing those muscles. And by temporary, Botox wears off after about 3 months. But by relaxing the muscles, you'll get a patient pain-free. So then you've addressed the issue. And the nice thing about Botox is as you treat them, they don't necessarily need it every 3 months, because as you break the cycle of that muscle contracting, after a while it kind of stops doing it. So many of those patients now go 6 months, 9 months before they need to be have any other type of treatment. Or they just wear the guard now. Initially they had the Botox, got them out of pain, and now they wear the guard and they're fine. And one of the things that people don't realize, I think a lot of people don't realize, is that last time I checked, the FDA, which is Food and Drug Administration, the only medication that's approved for the treatment of migraines is Botox. All the other medications that are given to people, pills, which have horrible side effects and a lot of times make people feel miserable, are being used off-label, meaning that they really weren't intended to treat migraines, but they found that it helps patients. So we've many times been able to get people so they're not taking medication now, pills that actually have made them feel sick and actually has some other adverse effects. We're able to get them off those, and now they wear a guard or a splint at night and have the Botox, and the Botox has no side effects. That's, and that's the wonderful thing about it. So that's been a really nice thing that we've added to the practice within about the last 5 years.